Hello, good morning.
Good morning, Doc.
Good
So
morning,
all
Doc.
so all groups are here.
Yes, Doc.
Okay. Wait ha.
Hindi pa ata nakapasok yung iba sa group 1, Doc. I think
Sa
there's
group
still
one, but no one is in the waiting room now.
One, two, 4, 5.
Lacking
Plato na po
5
kami, Doc, sa group 1.
7
Okay na po
students.
pala. Yeah, okay na po.
Okay. I'll proceed ha. So these cells are described as large, polygonal or oval when crowded together. Its nucleus is flattened and displaced to one side. So a thin strand meshwork separates these adjacent cells, forming a thin rim. The answer, what's your answer to this? Okay, answer, unilocular adipocytes. Next item, white adipose tissue is mainly found in which of the following areas? So what's your answer? Hard. This is hard. So the answer is greater omentum. These cells are described as multilocular, spherical with round eccentric nucleus containing multiple lipid droplets. So what adipocyte is this? Answer, brown adipocytes. You can hear me?
Yes, Doc.
Yes,
Okay.
Doc, we can hear you, Doc.
So next item, which of the following is the precursor cells of the white adipose tissue? Answer, perivascular mesenchymal stem cells. Next item, which of the following best describes the multilocular adipose tissue? Answer, spherical cells with rounded eccentric nucleus and have a usual diameter of 2 to 20 micrometer. Next item, white adipose tissue secretes this type of fiber. Answer, collagen type 3. Next item, which of the following best describes the unilocular adipose tissue? Answer, contain few elongated filamentous mitochondria with poorly developed crustade. Next item, newborn was delivered 30 minutes prior. As the nurse was drying the baby, the intern in charge noted that the baby was shivering. Which of the following best describes the tissue responsible for the shivering response? Answer, usually found in the cervical and supraclavicular regions of the neck, interscapular and paravertebral regions of the back. Next item, hibernating animals uses their large amount of fat storage for fuel and heat to survive the winter season. Which of the following best describes the adipose tissue responsible for metabolic energy storage? Answer, it is composed of a large mass of lipid deposit with few blood vessels. Next item, the following are considered classification of striated muscles except. Answer, none of the above.
Hello, Doc.
Yes,
Doc,
Cesar. Cesar, sorry, you're copy.
Doc, I have a question for this
Okay,
item, Doc.
yes.
For visceral, there's a choice, Doc, about visceral muscle. Would it be considered as the answer, Doc, since it's smooth muscle?
Smooth muscle. So this is a question. Sige, any other concerns for any item of the exam? Before I proceed, no clarifications, I'll proceed. So this is described as a sheath of dense connective tissue surrounding a collection of fascicles. Answer, epimysium. Next item, these are the structural and functional unit of the muscle fibers. Answer, myofibrils. These are seen as birefringent bands under polarized microscopy. Answer, A band. Next item, this is considered reals. Answer, sarcomere. This is described as a specialized cell-to-cell junction that binds the individual muscle cells to one another that help prevent the cells from pulling apart under the strain of regular repetitive contraction. Answer, maculae adherens. Which of the following are synthesized by smooth muscle cells? Answer, type 1, 3, 4 collagen fibers. Next item, which of the following best describes the skeletal muscle? Answer, cells are large, elongated, with many peripherally located nucleus, and the T tubules are found at the AI junction. Next item, which of the following best describes smooth muscle? Answer, cells are short, fusiform, 2 micrometer diameter, with centrally located nucleus. Next item, these are collections of nerve cell bodies outside the CNS, central nervous system. Answer, ganglia. Next item, these are described as morphologically heterogeneous cells that provide physical and metabolic support for neurons in the central nervous system. Answer, astrocytes. Any clarifications? Sige, I'll proceed. These cells are active in the formation and maintenance of myelin sheath in the central nervous system. Answer, oligodendrocyte. Next item, the sheath of the nervous tissue is described as having a web-like trabeculae composed of loose connective tissue fibers containing elongated fibroblasts. Answer, arachnoid layer. Next item, which of the following is referred as a bundle of axon in the peripheral nervous system? Answer, nerve fasciculus. Next item, this is the connective tissue that surrounds each fascicle. Answer, perineurium. Next item, this contains tracts of myelinated and unmyelinated axon traveling to and from other parts of the spinal cord and to and from the brain. Answer, white matter. Next item, which of the following best describes the Vater-Pacinian corpuscle? Answer, both A and B. So they are a specialized nerve ending with adventitious tissue for sensing of deep touch, pressure, and vibration. And they are onion-shaped, large, encapsulated ending structure of non-neural connective tissue built up around the nerve ending. Next item, which of the following best describes the nerve dendrites? Answer, both A and B still. The receptors that receive stimuli from other neuron or from external environment and carry that information to the cell body and contain spines that represent small protrusions of the plasma membrane containing actin filaments and postsynaptic density. Next item, which is a correct outcome of epiblast cell migration during gastrulation? Answer, formation of paraxial mesoderm from cells that evanginate through the cranial end of the streak. Next item, the ectoderm will develop into which of the following organs? Answer, cornea. Next item, blood cells develop from which of the following germ layers? Answer, mesoderm, lateral plate. Any clarifications from the batch?
Doc, I have a question.
Okay.
For the question, Doc, about the epiblast migration, can I ask what are the other choices po?
During gastrulation, no? Correct outcome of epiblast cell migration during gastrulation.
Opo.
Other choices, notochord formation from cells that ingress through the midstreak region. Another choice, formation of lateral plate mesoderm from cells that migrate at the lateral edges of the node. Next item, choice, formation of intermediate mesoderm from cells that invaginate through the cranial end of the node.
Okay, thank you po, Doc.
Any clarifications? Okay, I'll proceed. Which of the following is correct of the growth of the embryonic disc? Answer, in the cranial region, germ layers begin differentiating into structures as caudal segments gastrulate. Which of these genes contribute to head development and establish the cephalic region of the embryo? Answer, OTX2. Next item, which of the following shows epithelioid organization of tissues? Answer, islets of Langerhans of pancreas. Which of these motor proteins is responsible for retrograde transport during celiogenesis? Answer, cytoplasmic dynein. Mucous connective tissue provides support in which of the following structures? Answer, umbilical cord. A 36-year-old engineer often complains of burning sensation in his chest and sour taste in his mouth. His physician diagnosed him with Barrett's esophagus. What significant changes will occur in the organ? Answer, squamous columnar metaplasia. Brush border is found in which of the following organs or structures? Answer, proximal tubules of kidneys. Simple cuboidal epithelium is found in which of the following organs or structures? Answer, kidney tubules. What is the anatomical or morphologic classification of submandibular glands? Answer, compound tubuloacinar. Which of the following describes paracrine signaling? Answer, vasoactive factors from endothelium causing contraction of vascular wall. Any questions, clarifications? None, I'll proceed. Anchoring fibrils attach the basal lamina to the underlying connective tissue fiber. These fibrils are formed by which collagens? Answer, type 7. Dense regular connective tissue is found in which of these organs or structures? Answer, cornea of eye. The reticular fibers provide a supporting framework for all these organs, except, answer, thymus. Which of the following characteristics is the most distinctive feature of a macrophage seen under electron microscopy? Answer: presence of numerous cytototic vesicles, endosomes, and lysosomes. Which is a correct function of myofibroblasts during tissue injury and wound repair? Answer: it synthesizes collagen fibers and other ECM components for tissue remodeling. Which of the following components of hyaline cartilage is responsible for its resilience? Answer: intercellular water. While looking at the specimen under the microscope, first-year medical student noted the area of fatty degeneration. This will guide him in identifying which type of cartilage. Answer: elastic.
Doc,
First-
it's me.
Yeah.
May I ask, regarding dun sa dense regular connective tissue, is epitendinium to be considered an answer then po for your dense regular connective?
The question, this one.
Hmm.
Dense regular connective tissue is found in which of these organs? So your answer, this is Harvino,
Yes po, Doc.
is epitendinium. So I will ask Dr. I think Palomo for this.
Okay, Doc. Thank you.
Any other clarifications? I'll proceed. Fibrocartilage differs from the other two types of cartilage by which of these characteristics? Answer: absence of perichondrium. This type of growth in cartilage involves mitotic division of chondrocytes within an existing cartilage mass, interstitial. Cartilage may differ from bone by the following characteristics except connective tissue covering. 51-year-old male underwent cardiothoracic surgery for his coronary artery bypass graft. The surgical intern who assisted in the surgery noted that the surgeon applied perichondrial graft to the patient's costal cartilages. Why was grafting done on these areas? Answer: to improve healing of articular cartilages. The following bones are formed initially, but okay. John.
Can I ask if what else choices ng question regarding ang costal cartilage?
Cartilages. To stabilize the chest wall, to prevent the chest wound from opening, to prevent wound infection.
Thank you.
Can I proceed?
Yes, Doc.
Okay, the following bones are formed initially via intramembranous ossification, except answer: vertebra. In a developing long bone, the zone of proliferation is characterized by answer: actively dividing cells arranged in rows. Which of the following is true of adult long bone? Answer: the expanded ends consist chiefly of cancellous bone. These are coarse bundles of collagen fibers which extend obliquely to the long axis of the bone and connects the peristeum to the bone. Answer: Sharpie's fibers. During a practical exam, the student okay.
Regarding this question, Doc, from what I know, Doc, Sharpie's fiber is supposed to be 90 degrees of the long axis of the bone. So that's why I
You answer.
canceled it out. So
Sorry.
I just answered periosteal. If I'm not mistaken, Doc, because Sharpie's.
Any other thoughts from the batch? Okay. Any other clarifications? So I'll proceed. So during a practical exam in histo, the student was asked to identify the Foxman canal. What is the distinguished feature that will help him identify this structure? Answer, not surrounded by concentric lamellae. Which of the following statements describe the osteocytes? Answer, formative osteocytes contain abundant rough ER and Golgi apparatus. Bones of the extremities were formed by endochondral ossification. What is the prerequisite in the formation of these bones? Answer, fetal hyaline cartilage model. Bones constantly undergo remodeling to change its shape in response to mechanical load. This involves the action of which cells? Answer, osteoblast and osteoclast. What is the first sign of ossification in endochondral bone formation? Answer, appearance of perosteal bony color around the diaphysis of cartilage model. Any questions? A physician who uses his knowledge and skills of surface anatomy to identify important underlying anatomic structures is doing which approach in the study of anatomy? Answer, regional. In radiographic anatomy, studying which structures and the relationships using radiologic procedures which intends to help the clinician in his treatment of a patient is considered which study of anatomy? Answer, regional. A physician who involves the integration of his knowledge and skills in the study of anatomy, including physical examination, in the understanding and diagnosis of the underlying condition his patient presents, is considered doing which study of anatomy? Answer, regional. Which of the following events occurring in the 7th week of gestation and is the main reason joints from the knee below have a different definition of extension and flexion as compared to other joints, especially those in the upper extremity? Answer, 90-degree torsion of the lower limb opposite the upper limb.
Doc, question.
Yes.
Regarding that one, 90 degrees, Doc, is it not like 180 degrees torsion? I'm just clarifying, Doc.
Any thoughts from the other group? Can I ask Dr. Busa?
Sa to ng question?
Katong kuan, Doc, 7th
Isa.
week
Isa to.
gestation.
Yeah.
The answer
Yes.
was 90-degree torsion, the lower limb opposite the upper limb. And
Yes.
Harvey's answer is 180-degree
Harvey.
inclination of the leg.
Harvey. Yeah, okay. Harvey, it starts off in the 7th week of gestation as a 90-degree torsion, but it is completed into 180-degree by the pronation of the leg weeks after that. So the pronation of the leg, okay, occurs much later at beyond the 7th week of gestation. So it starts off with a 90-degree torsion, 90-degree torsion with the lower limb, because both the upper and lower limbs, they have some degree of torsion. Opposite ang the upper extremity rotates oppositely to the lower limb. Then following that 90-degree torsion of the lower limb, there's another event that occurs, which is the eventual pronation of the leg to complete 180-degree for the lower limb. So it's not even 180-degree pronation of the leg. So because you already have a 90-degree torsion of the lower limb, then the pronation of the leg completes the 180 rotation. I hope that clarifies everything.
Yes, Doc. Thank you so much.
Okay, thank you.
Ben,
Yes, Doc.
sorry, there's a correction for number 3. That's clinical. The answer there is clinical. A
Okay.
physician who
Who
involves
integrates
integration. That's
with
clinical
knowledge
already.
and skills in the anatomy, including physical examination in the understanding and diagnosis of the underlying conditions. His patient presents is considered doing which study? So correct answer is clinical.
Yeah.
Okay.
Okay.
Okay, so the next question is one with the radiograph. I'll try to show this. So which of the following radiographic images is considered taken in an oblique plane? So what's your answer? Any answer from the batch? Oblique plane.
Brain CT scan, Doc.
Okay, okay. So the answer is C, brain CT scan. Okay. So movements of the joints parallel to the median plane is called which of the following? Answer, extension, flexion. Next item, flexion, extension of the thumb occurs parallel to which body plane? Answer, coronal. A transverse plane which divides the abdomen into 4 quadrants is called which of the following? Answer, umbilical. Okay, a plane extrapolated midway between the spare border of the manubrium sterni and the symphysis pubis and is a useful landmark as it transects important structures of the abdomen, including the fundus of the gallbladder. It's called which of the following? Answer, transpyloric plane. The term volar aspect of the forearm refers to which side? Answer, anterior. Complete the following phrase. The wrist joint is located blank to the hip joint. Answer, lateral. In the Vulcan salute as shown in the figure, which of the following statements correctly describes the digits? So you're shown, can you remember the picture? Wait, I'll open that. What is your answer to that? So what is your answer to this one? So, na sila kayo nung silang answer. So the answer to that one is the third digit is laterally abducted. Okay, with the patient in an upright position, which of the following structures would be transected by the transpyloric plane? Answer, root of the transverse colon. Any other clarifications for the anatomy questions?
Excuse me, Doc. Mag-ask lang ako kay Doc Busa po regarding that one.
Sige, what's your question, Harvey?
Would it, same lang ba siya, Doc, if we're going to say root of the transverse colon or the mesocolon? Ba yun siya? Colon.
Wait, do you have an option like that?
yung ano lang, may option dun, Doc, na yung sinagot ko kasi yung root of yung transverse colon. Then, or would it be the same, Doc, if we're going to say na the root of transverse mesocolon? Meso?
Yeah, that's the same, but the you don't have that option. You only have the root of the transverse colon. Right.
Just wondering, Doc, if it's the same if ever mag-ano siya.
Okay.
Thank you.
Hello, Doc.
Yeah.
Doc, for same question, is there pylorus in the choices?
Who's this? Cesar?
Cesar, Doc.
Yes. Okay.
Cesar, Doc.
Why would you say the pylorus is an answer here in the same question?
I saw it in the enumerated when I was reading, Doc.
Yeah.
That said transpyloric plane also traverses pylorus.
Right. Okay. As the name implies, is transpyloric plane. It should transverse the pylorus. But it is very specific that in an upright position, usually your bowels will fall down below. Especially the pylorus, it will fall down below this plane. So what is more consistent would be the neck of the pancreas, the origin of the superior mesenteric artery, the root of the transverse colon. So those are the more consistent and does not usually droop when your patient is upright. But the pylorus will have a tendency to really droop. But you are correct. If you're talking about the transpyloric plane, it will traverse the pylorus. But this is on the premise that this patient is lying down.
Okay, Doc. Thank you.
Any other clarifications for the anatomy questions? Okay, I'll proceed to the biochem and fission. So which of the following diseases result from a defect Hunter syndrome? Which of the following diseases does result from a defect in alpha L isoderonase? Answer: Hurler syndrome. Which statement best describes Marfan syndrome? Answer: mutations in the gene for fibrillin 1 is a cause. Which statement best describes elastin? Answer: some proteins of tropoelastin are hydroxylated to hydroxyproline. Which step in collagen biosynthesis occurs intracellularly? Answer: formation of triple helix. Question: which is most often found in the X position of the XY sequence of collagen? Answer: proline. Which glycoprotein has a high content of O-linked oligosaccharides and exhibit repeating amino acid sequences? Answer: mucin. The binding sites for extracellular matrix components? Answer: all of the above, meaning collagen, fibronectin, and laminin. The sugar component of mucin is GAL-NOC, GAL and AC. Which of the following best describes advanced glycation end products? Answer: increased collagen cross-linking leads to atherogenesis and glomerular basement membrane damage. And what amino acid does the linkage of GAGs to core proteins to form proteoglycans occur? Answer: serine. Any questions for biochem? None. Okay, I'll proceed. Which of the following best describes the regulation of oxygen and carbon dioxide concentrations in the ECF? Answer: stimulation of the respiratory center results in a decrease of carbon dioxide concentrations in the blood and tissue fluids. Next, which of the following describes the normal body temperature? Reference Gano. Answer: rectal temperature better represents the core body temperature. Which is true of the mechanisms of heat loss? Answer, tissue conductance is affected by the degree of cutaneous vessel vasoconstriction or vasodilation. Which of the following temperature regulating mechanisms is activated by cold? Answer, increase epinephrine. Which of the following is true of the neural control of thermoregulatory mechanisms? Answer, lesions in the region of the anterior hypothalamus can cause hyperthermia. Which of the following best describes the mechanisms of fever? Answer, endotoxins from invading bacteria can cause the release of endogenous pyrogens. Which of the following is true of the body's acclimatization to heat? Answer, results to an increase in plasma volume. What is the normal range of value for venous partial pressure of CO2? Reference Guyton. Answer, 35 to 45 mmHg. Under normal conditions, which of the following has the smallest concentration in the ECF? Answer, calcium. 50-year-old female came into your office for chronic EC fatigability and weakness, increased sensitivity to cold, facial puffiness, and lower extremity edema. Upon PE and laboratory, your primary diagnosis is hypothyroidism. Based on this case, which of the following is correct? Answer, decreased thyroid hormone level depresses metabolic tempo, causing the patient's symptoms. 70-year-old male patient is admitted in the ICU for respiratory failure secondary to severe pneumonia. Patient is hooked to mechanical ventilator for respiratory support. You were on duty as a medical resident for this patient. ABG showed significantly elevated CO2 level. Based on this patient's case, which of the following is true? Answer, an intact respiratory center will cause the patient to breathe more deeply. A 24-year-old male patient was rushed to the emergency room for a motor vehicular accident. ER ongoing significant blood loss was noted from an open leg fracture. Thus, an urgent orthopedic and vascular surgery was contemplated. Which of the following is true of this case? A negative feedback should set in prior to a positive feedback in order to prevent death. A 40-year-old male patient is admitted for severe dehydration. Patient's blood pressure at ER is decreased at 70/50. As a medical resident on duty, for this patient, aggressively administered large boluses of IV fluids to correct the hypotension. Which of the following would help improve this patient's condition? Answer, patient's baroreceptor should stimulate the vasomotor center. 30-year-old female patient is admitted for pneumonia, later found out to be caused by Klebsiella pneumoniae, a gram-negative bacteria. During the acute stages of the illness, temperature spikes went as high as 39 to 40 degrees Celsius, with intermittent episodes, chills, and flushing. Patient was given aspirin, which effectively controlled the fever. Aggressive antibiotic therapy later resolved the infection. Which of the following is true for this patient's course? Answer, endotoxin increase interleukin-1 to cause fever. The primary motor center for shivering, it's dorsomedial posterior hypothalamus. Then the last question, which of the following mechanisms is activated by cold? Answer, hunger. Sige, any clarifications for the visual items? None? None? Okay, for those who received the Unit 3 schedule already, so I place in their tentative schedule for the subjects for each written exam for the bi-monthly. So if you have, if you decided to switch the subjects or make it a Tuesday, Wednesday exam, it's fine with me. You tell me so that we can finalize it. Okay, any other concerns? None? Okay, you can go and have lunch. Have a
Thank you.
fruitful weekend.
Thank you, Doc.